evening and welcome everyone to our Zoom session. Today is our 912th day. Let's start our webinar with a silent prayer. Good evening once again and welcome everyone to our today's session. Today is our 912th day and continuously we are conducting this session without any break. Thank you all the participants for your support and appreciation. And today's our guest is Dr. Sadhath Sait. All of you know him very well. He has taken classes many times in our webinar, and he is the active member of our Ernakulam chapter. And he's running running clinics in Ernakulam and Aluva, and he has 26 years of experience, and we have seen many of his miraculous treatment through his classes. And he is the leader in many organizations, and he has that leadership quality, and he's a helping hand. And I'm welcoming Dr. Sadhath Sait to today's webinar. Sir, please welcome.
Thank you, Dr. Ajani. This is the after effect of our family get together.
Yeah.
we have just met once.
Yeah, only once. No, twice we met.
Twice we met. Okay, but that meeting was just for a few minutes.
Yeah, meeting.
You were talking more. Okay. Anyway, let us and thank you, and let me thank you first of all the IFPH for inviting me again. Today, I really don't know. I'm just going to start with my experience from the stomach disorders or any abdominal disorders we have started with. That's my experience. When I tell you my experience, it's experience from my practical experience of my clinic. Statistic wise, if I cannot even count how many patients we have given these medicines. So many patients we must have given these medicines. How the clinic, how a clinician comes to, or a patient comes to my clinic. That's something which we have to learn. A lot of cases we know how to take the cases. A lot of seniors and everyone are talking about classical methods of practice, everything. But my way is when acute comes in, what to do, how to take case. Case taking is okay, everyone knows it. But what are the medicines to be prescribed? What are the medicines to be thought of? How to handle this acutely? That becomes a little more tougher. And I think these medicines can, I'm going to tell you is can help you in many ways. Okay, let me share my this one without
Sure.
even. Okay, can all see that?
Yeah. Burning suspected of gastric.
Okay. Stomach, right? Okay. The basic thing is how do a patient comes into our clinic? Once the patient comes in and starts explaining, I got a wonderful experience today. I don't know how to handle the things. I'll tell you that experience and we'll go into directly into the cases. A 14-year-old boy has been under many treatment, including homeopathy from different doctors. Allopathy, Ayurveda, homeopathy was the last thing. The best part is that they went to the homeopathic doctor. She prescribed few medicines and his complaint was better in 2 days. Okay. And after some time, a week or two, they came to me. In 2 days' time, the patient was better. I said, if it was better, you should have continued there. Why did you come to me? They said, homeopathy better in 2 days. That is giving us a suspicion. And how can a homeopathic doctor can give us such a relief in 2 days? She must be adding something else. I said, you went to all other doctors. They have given you medicine. More than that, homeopathic doctor doesn't know how to add another allopathic medicine or something into homeopathic medicine. They have given all the allopathic medicines. You are not better. When a homeopathic doctor is giving you relief, why don't you stick with them? I said, no, we have some doubt. Okay, fine, come. And the same doubt is continuing still now. The patient is with me. Why I'm telling you all this is, patient had a GERD. But the problem with him right now is pain below the below the umbilicus, just above the pubis bone, nowhere else. Okay, it is not radiating, it is not going anywhere, it is not having any other pain, only pain there. Aggravation food, aggravation night 8 p.m. to morning 6 p.m. This is the only uh, this one symptoms I am getting it. All examination done, everything pressed, everything palpation was done, nothing, only no pain, nothing, only the symptom is this. So they are also panic. We are also panic because why pain there? You cannot. I cannot even diagnose. So I had to call up my regular sonologist. He started helping me out, saying that it could be a symptom of a GERD, but get a scan done. So diagnosis is more important to convince patient. You can give any number of medicines, but diagnosis comes first thing in the treatment of homeopathy. Diagnose the case first. Now the patient is happy. It is diagnosed as GERD, no other complaint. They are comfortable. That is the first thing we have to do. Any pain abdomen or anything related to abdomen, examine the patient. That's the first and foremost. Take the case. Once you know that, okay, this could be connected to your abdominal issues or stomach issues or whatever it is, examine the patient. Put the patient on your bed, examine. So once you start this case, I could save it because I could tell them, okay, this is GERD, nothing to be worried, continue medicines, he'll be okay. Yesterday we diagnosed the case, today onwards he is better. I'm not telling it's because of my medicine. It is because I have diagnosed the case clearly and they are peaceful at mind. They are sure that, okay, there is nothing left out. They are thinking about cancer, they are thinking about prostatitis, they are thinking about a lot of other companies. So they were confirmed. That is something which we have to think about it before taking the case. Diagnosis. Examine the patient thoroughly, especially abdominal. Abdominal cases without even touching the abdomen, we give medicine. Please do avoid that. Take the case, examine the case, diagnose the case, then the medicine comes. Okay. So I'll start with my experience of giving the medicine. Patient comes to us with telling that I have lost appetite. I know a lot of medicines are there, Nexomica to hydrasis to everything. But my first medicine is lecithin. My first and foremost prescription could be lecithin. Lecithin has this anemic also, plus that craving is there, the pain is there, appetite, no reason. You cannot even tell you what could be the reason, nothing. If it is anemia, if it is HB low, and he has got appetite low, and the stomach, if you examine, you don't get anything, then think about lecithin also, along with other medicines. Okay, lecithin also can be used to increase your breast milk. Causes immediate decrease in phosphate secretion through the urine. Lecithin has been given successfully with a case of a kid. It is going on. A kid walks with on toes. Exact medicine is given on toes. So think about those cases where there is a tendinoachilles pull or a shortage of the muscle or anything of that sort. Think about lecithin. Okay. Then strychnine. Strychnine force. Strychnine and nitricum can be thought about craving for alcohol. Alcoholism. Strychnine as also, the strychnine group is very important even in the stomach cases. Strychnine group, strychnine as is one of the best medicine for diabetes. We hardly use it. We hardly think out of the box. Okay. At times we have to tell the patient to bring the sugar down because 400, 500, 300, 400 patient gets panic. Bring the medicine sugar down. Fluoridazine, another one of the best medicine for the bringing down the sugar immediately. Then you can think about taking case, emotional disturbance, all that stuff. You can think about it. If constitution can be given, all that is a part of our treatment. Everyone does it, including me. Another one is appetite perverted, cravings. Everyone comes in. 90% of the patient comes in with this kind of a symptoms. The medicines are, we give antium crude, antium tartars, everything. But along with that, acid first 30 or 30. Give it for few days. You will get the result. Macab. Macab is another medicine which has even helped in COVID. Okay. So along with fever or anything of the sort or abdominal problem, the smallest of the ulcers, if you have a perverted appetite or craving, think about Macab. Okay. And craving aversions also. Most of the cases has this. Hematemesis. Hematemesis is another complaint we get it if there is a gastric ulcer or duodenal ulcer. These two things we'll have to think about it. If there is an occult medicine, occult blood, examination, investigation, lab investigation is a must, even in the case of hematemesis. Hematemesis, occult blood, we have to find out if it's an occult blood or a fresh blood. Okay. So fresh blood, if it is a fresh blood, we have a lot of other diagnostic criteria and with the medicines, with the kind of a blood you see, fresh blood, our medicine itself is changing. It can think about the phosphorus to hemamelis to bilifolium to lot of other medicines. Okay. So how do we differentiate? Is lab investigation is needed? No, that is a sign. If there is an hematemesis or rectal bleeding, fresh blood, polyp to what are called hemorrhoids, fissures, polyp, fistula. You should think a lot of it. Then differentiate the medicine according to the patient. Emergency or acute, you handle with acute complaints or acute medicine. Constitutional medicine like ulcers and this one is not as fresh ones. It has a long duration. Think about constitution along with your mathematic and other things. Cocaine, hematemesis. You just think about these medicines. Cocaine is one of the best medicine you try. Cactus. We never think about cactus. In the case, we think about cactus only on the cardiac complaints. We have got a pain or something, so we just think about cardiac complaints. Okay, diagnose the condition. Then hiccups. Hiccups are very common. 90% of the patient abdominal complaints comes with hiccups. Continuous hiccup, gas formation, Cajaputam. Cajaputam is one of the best medicine other than carbo vegetalis. Every medicine is there. I'm not denying all that. Everyone has tried that. Every senior doctors, the junior doctors first thinks that Cajaputam, this one, Nexomica, carbo veg, everything. I'm not that medicines are very good, but along with this, try this medicine also. Cajaputam is one of the best medicine. It is also called Oleum vitnabunum. Cajaputam is commonly available. The one of the best medicine. Okay. Hiccups. Another thing medicines to be thought about is morphinum. Morphinum 30, one of the best medicines. Zingam valerianum. These are my experience. I'm telling you this experience even if a doctor giving a 50, 60, 70 patients cases. More than that. Okay, morphinum is one of the best medicines. Hiccups will go immediately. Zingam valerianum will go faster. Both the medicines are very good. I'm not denying all the other medicines, seniors. These medicines are important. Hyperacidity. We always think about Kali bike to Nexonica to Hydrastis to all other medicine. This is Oraxanum tannum. Try this. You will get it. It's available. Oraxanum tannum. Okay. Boric has given it. Try this medicine. Indication is severe hyperacidity. Robina is one of the another best medicines. You can think about it. Oraxanum tannum is one of the best medicine. You try this in patients. You will have a good result. Okay. Indigestion as per the cause. That is important. For the indigestion, causation is more important. You get a good clear causation. Some people will come and say, I don't know, doctor, what I had yesterday. I just had a simple meal what we cooked at home, but they forget to tell you. They must have also had something else from the hospital. Okay. Indigestion as per the cause. If it is indigestion because of the sleepiness, okay. Indigestion due to cholelithiasis. Natramure is one of the sleeplessness. Okay. Natramure is because we have a lot of this temple festival, church festival. Everyone we go for late night movies. At least city we go. At least my ticket timing is at 10 o'clock. I book only for 10 o'clock show. So 12 o'clock, 1 o'clock we come back and sleep till. So at times sleep gets disturbed. Natramure is one of the best medicine. Natramure we hardly and rarely think about for the indigestion. Try this. Okay. Next, mosqueta. Pelturi. Pelturi is one of the best medicine if there is a cholelithiasis or gallstone problems. Epiphagus. Okay. Epiphagus is one of the best medicine even for the indigestion due to sleeplessness. Headache due to indigestion. Okay. Ignatia is one of the best medicines. Why? I'll tell you the contradiction. Indigestion cannot cause your headache because indigestion happens in the stomach. This happens in the head. So what is the connection between indigestion and head? So it's a contradictory. Always Ignatia is a contradictory medicine. Okay. You have this one laughing when they are sad. Some contradictory. Every time there is a contradiction. We cannot even think about a proper symptom connection in the Ignatia. That is also used here. Gastritis. Gastritis, one of the best medicine is Kali bike. I can even tell you pain in the epigastrium. You can even close your eyes and give it. Kali bike. If you don't get a constitution or clear-cut medicine or anything like that, to not even to give relief, it can bring you the cure also. Why Kali bike is? Kali bike pain is in spots. That is why every pain of Kali bike is in spots. Gastritis, epigastrium, there will be a pain on the spot. Okay, it can be esophagitis, or it can be antral ulcers, esophageal esophagio-pyloric ulcers. Kali bike is one of the best medicine. Gastritis due to alcohol. Gultheria, cuprum. We hardly think. I can even give you thousands of cases of alcoholism. Only 10-15 medicines. Because 99% of the cases of the alcoholic patients have not seen. Relatives come and tell that he has got alcoholism. Why don't you start medicine? So we have got a lot of medicines. I'll just ask 1 or 2 or 3 few cases, few questions. Give the medicine. So gastritis, if it comes to acute gastritis, think about cuprum and gultheria, also along with nexomica, along with other complaints, Kali bike, whatever the medicines you have known, along with all that complaints, along with the constitution, along with the acid nitricum, along with the acid sulfuricum, along with other companies. These two medicines also ranks good. Nausea. Nausea. First medicine comes as Ipecac. Why is phrenic nerve involvement? Okay. Other thing medicines can be petroleum, apomorphinum, and morphinum. Petroleum, apomorphinum, and morphinum. Okay. I just wanted to tell you one. This is not related to the stomach, but it is related to the uterine bleeding. And thank you to Dr. Anil and Dr. Jodi. Epihisterinum, that has worked wonders. Epihisterinum 30 has worked wonders in stopping the excessive bleeding. Trivandrum Anil Kumar, your treasurer. Okay, so we should appreciate all this. You should learn from small things and give that. Do the trial in your clinic. It has given me a good result. Okay, so I'm just adding it to it. Nausea, petroleum. Petroleum we never think about. In indigestion, we think about petroleum while riding in the carriage. Vomiting, nausea, all that comes up while riding in the carriage, not associated with your stomach. Petroleum and apomorphinum and morphinum. And depends upon the specific cause. If it's a specific cause, you have a lot of medicines are there depending on the specific cause. Burning suspected of gastric ulcer. Burning suspected of gastric ulcer. Every time the patient comes and tells me, I have got a great burning. Trials of burning is there, sulfur is there, all that is there. Along with that, go for Condurago. This is Condurago, not CU, it's CO, Condurago and oxalic acid. These two medicines are one of the wonders. You try this along with, or what are the medicines you wanted to try, but try this also. Epigastric pain, another one, only pain. Abies canadensis, Abies nigra. Abies nigra and Abies canadensis, they can give you as if something lodged. If you get that, nothing else. Raphanus is also there. Globus hystericus, Raphanus is also there. But along with this, Abies canadensis and Abies nigra. If it is the patient is aged, Abies canadensis. Okay. Gastritis and gastralgia with constipation. Plumbum met. Gastritis, gastralgia with constipation. That is a PQRS symptom. If you have constipation along with gastric burning, PQRS symptom is plumbum met. Okay. Another symptom is abdomen distended, tight clothes intolerable. Usually we give it lacasis. First and foremost thing we think about is lacasis. But these two medicines, graphitis and ambra, is one of the best medicines. You can even think about it in better way. Can you give me 1 minute? I'll just have some water and come, please.
Sure, doctor. And while you're sitting, sit forward, because while you're talking, some fluctuations are coming because of light, I think. Okay.
Okay.
Now it's okay. Sometimes while you're talking, it's
okay.
okay.
Okay. So this one. Okay. Abdomen distended, tight clothes, intolerable. You can even think about lacasis. Lacasis is the first and foremost medicine we all think, but these medicines can be thought about. Okay. Empty, faint feeling. Empty, faint feeling in the abdomen or epigastrium. You have all the lot of medicines, but Barata, Mure, try that. That's not because of that. Maybe my video. My video something has some issues. Okay. Sorry. Empty, faint feeling is Barata, Mure. I'm not denying all the other medicines. Constitution, I don't know, but paracetamol is one of the best medicine in my experience, has given me the best results. Sometimes our patients come and tell you there's a pulsation, there's a throbbing in the abdomen or in the epigastrium or anywhere, crotalus horridus. Clear-cut symptoms you get it. Our patient comes and patient will come and tell you, doctor, I have no other feeling other than once in a while this I have got as if some palpitation in the stomach. Or if it is in a local language, you know, no. So there's a palpitation like a heart palpitation. I'm feeling it here, or I'm getting a palpitation in the abdomen or epigastrium. Crotalus horridus, you think about it. This is common symptom. I'm not talking something very rare or anything. Ulcers. The juniors are not getting anything else. Geranium maculatum, Mercol, ornithogalum. Calibike, everything is an exomica, all that is there. But Geranium maculatum is one of the best medicine. Mercsol and Mercury group, Mercsol, Mercor. Ornithogalum is one of the best medicine. Try that out. Vomiting in drunkards, non-stopping vomiting in drunkards. Give Cupramet. This medicine I can even, I don't know how many I've given it. Cupramet has helped me a lot. I have a history of listening to this patient. Few patients come and tell me, oh, alcoholism, they, what call, one patient, one or two patients came and told me, one patient after drinking, he goes into the kana or the sewage. He takes a rat. He picks up a rat, he kills the rat and give it to the wife. Wife has to cook the rat and give it to her. That medicine is syphilinamide treated with the alcoholism. Okay, rat meat. He wants to eat after alcoholism. Nothing else. So that's one of the best experience. Syphilinum helped me. So vomiting in drunkards. One or two dose. The patient starts vomiting. Not one vomiting, starts continuously vomiting. Cupramet is one of the best medicine. Vomiting in pregnancy, that is also part of the stomach. We have amygdalase to lot of cases. Cuprum aceticum. I don't know how many have tried that. Cuprum aceticum, lactic acid, and MAC-carb. These three medicines also can be of lot of help for you if you don't get relief from all the other medicines. Food undigested. Ferromet and ferromet is one of the best medicines. If it is given in a lower potency, that gives you more result. Okay, ferromet 3x to 6x will give you one of the best, one of the good results. Food undigested. Passes food with undigested. Lycopodium is there, but ferromet also can be thought about. Okay. Flatulence, distension of the stomach. Again, Kajaputam. Lachesis because it's sensitivity. Graphite is in next mosquita. Nexomica, Carboage, and all other complaint medicines are there, which we commonly use it. But these medicines can be thought about and used very effectively. Because homeopathic metriamedica has all 4,000 medicines. We have humpty number of ways to reach into the one simillimum. We have Kentian method, we have Boric method, we have Bonninghausen method, we have Murphy, we have every road leads to Kochi. Same way it is. You come to from Kottayam, it should reach Kochi. So however you come, medicine has to be this one, patient has to be better. Okay. Flatulence of distension of stomach, Kajaputam is there, Lacus is another one of the best medicine, Graphitis is the next mosquito. Okay. Pain immediately after eating. Patient will come and tell you, doctor, if I eat something, I get pain. We ask them, After how much time? Is it on the spot or after some time? To differentiate duodenal ulcer with other ulcers. So gastric ulcer and duodenal ulcer, the main diagnostic feature is the pain comes when and how. Sorry, I don't know why this is happening.
But when you are coming forward, it is not.
It is there always. I'm touching
No,
the.
no. Now,
Okay, focus.
now it's okay, but
It's okay, forget it. Okay, pain long time after eating, agaricus. Pain immediately eating is calibike and calicab. Okay, pain immediately eating is calicab and this one, calibike and calicab. Pain long time after eating is agaricus. That's one of the best medicines for gastric ulcers or duodenal ulcer. Okay, pressure as if it's from a stone. This is all we get it every day in the clinic. Doctor, I feel as if something is there in the stomach, as if something heavy after food, as if some, in local language, it's been a karingal. It's a rock that has been kept in the stomach. That is why the diagnosis is important. It could be a feature of a CA stomach. So we should diagnose it. Okay. So pressure as if from a stone, abyss nigra and phosphorus. Phosphorus is my favorite, all-time favorite. It's one of the best medicine, even from viral fever to uterine bleeding. Phosphorus is one of the key medicines I have faith on. Abyss nigra is one of the best medicine. Think about it. Regurgitation, sore regurgitation, pulsatilla and phosphorus. Try this, pulsatilla and phosphorus. Phosphorus again, phosphorus is universally what are called? We say no. Polycrust. For me, phosphorus is a universal polycrust. Okay. Gastritis, another medicines can be thought antiemtat. Beautiful, antiemtat and phosphorus. Gastritis from alcohol, we are told. Nausea, we have told you everything about this. Pain, abdomen, aggravation, beer. Aggravation, beer. Pain, abdomen, aggravation, beer. Kali bike. There is no second thought. Okay, Kerala is flooded with alcoholics. So beer is giving you pain, Kali bike. Aggravation from food, any kind of a food, urgent and nitricum can be thought about. Other than that. Okay. Empty, faint feeling. Again, murex, phosphorus, abyss canadensis, and lobelia. Along with, I just added one or two medicines more, lobelia. For the ulcer, another medicine is symphytum. Symphytum is one of the best medicine for eye injury. Along with that, symphytum is medicine for any ulcer. Along with that, gastric ulcer and duodenal ulcer, symphytum. Okay. Instead of sticking it to one medicine, think about the symptoms of few medicines. These are one of the best medicines. Vomiting, I told you, drinks of any kind cause vomiting. If he drinks water also, he vomits. Bismuthum, cantharis, we hardly think about it. Epitorium perfoliatum. Phosphorus, another best medicine even for this. Okay. Cupromas is also one of the best medicines for the drunkards. Nexomica, as usual, it is there. Appendicitis, iris tenax, everyone knows it. The iris tenax, bryonia, majority of the cases can be treated with iris tenax. Okay. heartburn. Another iris group is there. Iris was iris was. It is like burn from esophagus to not esophagus down to the rectum. Iris versicolus. Abdomen colic pain. Kajaputtam plumpum met. This plumpum met is one of the best medicine for what is that? Interception. Interception. Colic plumpum met 200. I can even specifically, thanks to Dr. Chandrabanu, plumpum met 200 interception. Okay. Colic biliary gallstone, Berberis vulgaris and colocin. Flatulence colic, polygonum punctatum. Flatulent colic. If you don't get anything else in your mind, if you are confused, if you are a beginner or anyone, polygonum punctatum. That's one of the best medicines. Hemorrhoids also you can use it. Skin superficial ulcers also you can use it. And sore, especially in females. Superficial ulcers, especially in females. When the females walk, these two thighs gets rubbed. And there comes the ulcers or the skin gets cut. Especially fatty females, if they walk, you can give calendula, all that. You can think about polygonum punctatum also. Cajaputum and argentum nitritum. Umbilical pain, granatum, especially for the kids. Fistula ano, pioneer. Fistula ano, I know everyone is an expert in treating fistula ano. But fistula ano, before treating it, go for a fistulogram to find out. See, we cannot just tell them, okay, we can't just tell them, okay, this is cured, that is cured. We need an evidence. So before you start, ask them to get a fistulogram done. Plus, during also you can ask them to find out what is the progress of the treatment. Okay. Okay. So go for a fistulogram before starting fistulo treatment, because we need advice, evidence. We have done this. Okay. Hemorrhage during stool. Merc sol to Merc core to everything we tried. If you are not successful, try alumen. Not alumina, it's alumen. Okay. Inflammation of the rectum, proctitis. Where do you get this? Lactose intolerance. There's a red color. Lactose intolerance. Sulfur is one of the best medicine. Kids, chamomile is another medicine. Colinsonia. Okay. Colinsonia is one of the best medicine. Sulfur, 90% of the cases it gives you results. Colinsonia is also another one. Itching of the rectum. Only itching is there along with the hemorrhoids. Colinsonia, indigo. Saccharum lactis. Saccharum lactis, saccharum lactis. We have medicine. Indigo, sugar of milk. Okay. Saccharum lactis 30. Indigo is another medicine. Indigo 30 gives a better, good results. Colinsonia is also another medicine. Long lasting pain after stool. 100% Mercor is the first medicine, but graphite is also another one of the medicine equally important. Sedum acre is another equally important medicine. This is from my experience. I know 101 doctors are there, seniors are there. They have a lot of other experiences. Yes. Prolapse ana, if it is, you cannot manage your first degree, you can think about treating it. Second degree also you can, after that, don't ever keep it. Refer it. Okay. That's my experience. I don't know about seeing other people. They must be having a lot of other. My experiences, I don't take those cases because it's not easy. Especially 3-4 postpartum, 3-4 after 3-4 deliveries. Especially Muslim families, you get this. Okay. Because they have, my grandmother, she used to tell me I have 12 kids. My mother's died, 12 kids. 9 kids or 10 kids. I don't know how many counters there still now. So all these conditions you get prolapse of ani also, prolapse of uterus also. Okay. Constipation due to hemorrhoids, cholinsonia, Aspilus glabra. Aspilus glabra is one of the best medicine even for esophageal varices. It is almost specific for esophageal varices. Aspilus glabra 3x or tincture. This is my experience. Okay. Constipation in infants. I know that everyone has been treating infants. It's a common case in any clinic. Cholinsonia is another one medicine. Paraffin. Paraffin is one of the paraffin 30, paraffin more than that. If you get it, try that out. Okay. Pancreatinum. Pancreatinum is one of the best medicine. Medorinum. Medorinum is one of the sure shot medicine if there is a megalacolon, congenital megalacolon. How do you differentiate? Parents will come and tell you the kid wants to go only in standing. He cannot sit and pass. He screams if he wants to sit. He can pass only while standing. He's scared of going to the toilet. He has to pass only while standing. So that could be a cause of congenital megalacolon. Give medorinum, that too in a higher potency. Okay. Constipation in old people. Selenium. We know Baraita Kaptu, all other selenium. Because selenium is weak. Selenium is weak. It gives a nervous weakness. It can be one of the best medicine thought about in erectile dysfunction, hair fall. Okay. Diarrhea. Gambogi is one medicine. I'll tell you later. I don't know. I am just not getting the full explanation. NUPH, we tell that. I write it NUPH to the patient, to the staff. So that staff is taking care of it. Diarrhea, another continuous diarrhea. No, the patient is active. Kid, phosphoric acid. Okay. Diarrhea after fatty food. All not pulsatilla. Even cholesterol also you can be thought about it. Cholesterol, because fatty diarrhea after fatty food. What could be the diagnostic processes? Cholelithiasis. Okay. Cholelithiasis, if you have it, this sometimes could be. Sometimes the gallbladder would have been removed also. So you have to ask for the history. Diarrhea after fatty food, pulsatilla, cholesterol also can be thought about it. It's one of the best medicine. Spluttering expulsion. The patient who sits in the toilet and everyone can know that he's in the toilet. Okay, Jetropha is one of the best medicine. If his wife or relative or anyone tells that doctor, if he goes to the toilet, everyone comes to know that he is there in the bathroom. Jetropha can be thought about. Okay, frequent diarrhea wants to go. He comes down, then goes up. Frequent diarrhea, cupromas, phosphoric acid, Merck valeriana. Along with this, these are the three regularly used medicines by me. Involuntary when passing flatters. Patient comes and tells you that when I say pass flatters, small quantity of stool passes along with that. Oleander, again phosphoric acid. Acid phos is one of the best medicine for hair to any complaint, even for the urinary complaint, phosphates, everything. Phosphoric acid is, you have to read. You have to read phosphoric acid. It's one of the best medicine. Involuntary when passing urine. When you passes for flatters, oleander and phosphoric acid. When he passes urine, muriatic acid. Think about it. Causticum is there. Another medicines are there. Muriatic acid, we hardly rarely think about it. So think. Offensive stool, terebinth and sorena. Terebinth and sorena as one of the best medicines for offensive. All other of a carbo animalis is a carbo which is there. So these medicines also can be thought about.
Doctor, our time
Okay.
8:45.
Okay.
And
Sorry, I don't
it's
know. I don't know why my video is not. I'll have to show it to the people.
okay. Now it's okay. I told you, no, in some posture only. Those who have questions, you can ask the questions to Dr. Sadhath Sait. Please raise your hand and ask questions. And Nufar Lutia.
Nufar Lutia, yes. And I write NUPH.
Dr. Jyotilakshmi.
Nufar. Okay. Nufar luteum is one of the medicine even for erectile dysfunction. Think about that.
So, okay, Dr. Hubert.
Can you hear me?
Yes,
Yes.
sir.
Okay, very nice. You are always coming with medicator. So I think problems, not from his part. That is whenever they are talking that time. Previously, I have seen such problem. Doctor, I want to ask you a very nice presentation, and you are always like that. Doctor, I want to ask when there is acidity, hyperacidity, immediate result relief. Any medicines you can suggest?
I told you. Kali bike
Kali bhai,
and higher potency.
is okay.
Higher
means
potency. 10M.
10M. Okay.
10M, 5 minutes, 10 minutes repetition. And 15 minutes will be better.
While they are taking sambar, paripa, that time, these are all.
You don't get time to ask all this. He will come and tell you pain is there. Immediately give one shot of Kali bike. Then make the patient talk.
Okay.
Then you can go for the causation, why it does all that. Patient has to be relieved. Patient has to be better. Once the patient is better in your chamber within 5-10 minutes, he is the best ambassador for you.
Thank you, doctor. Thank you very much.
Thank you, Dr. Hubert. Dr. Manoj, please.
Thank you, Dr. Adini. Well, my intention is to congratulate Dr. Sadhath Sait for 2 reasons. One is this huge collection of therapeutics he accumulated by a lot of hard work. It's one thing. And he said about that phosphorus is his favorite medicine. I think there is a component of phosphorus in him. That is why a couple of days back we witnessed that he went to visit our Dr. Ramadevi Ambadi on her 75th birthday and facilitated and we become a part of the birthday celebrations. That may be the reason you went there. Anyway, nice presentation. This should encourage others to read the Materia Medicas and accumulate all these things. Even though this is a small portion, a lot of conditions always annoying the common man without creating any problems, without creating any injury, without adding to something to the existing problem, it can be solved. That's the beauty of your presentation. Congratulations. Thank you, doctor.
So I went today also to have the sadhya.
Yes, that's good. That is why I said there is a phosphorus component in you.
Okay.
Okay, thank you, Dr. Manoj. Now, Dr. Hariharan.
Okay. Dr. Sadhath Sait,
Yes, sir.
Congratulating for therapeutic work.
Thank you.
Along with the scientific study or case taking and classical prescription, sometimes we can give the therapeutic medicine also. One of my doubt is that any medicine for hiatus hernia, have you got any experience?
I have not got any experience. I've got experience, but no results.
No positive result.
No positive result.
Okay. See, almost all medicines you have narrated about Madhya Pradesh. What is Madhya Pradesh? Do you know?
Madhya Pradesh.
You have not understood. Do you know, Mr. Dr. Manoj, where is the Madhya Pradesh? See, Madhya Pradesh is the place where in between upper and lower bodies, body. That is the Madhya Pradesh. Stomach, abdomen, and all. So you went through all the medicines regarding Madhya Pradesh. Very nice presentation.
The rest everything is over. From head to foot, almost I've reached there. This is the only thing left out for today. Yesterday night only Dr. Dinesh reminded me.
See, almost all persons are concerned with the stomach symptoms and abdominal. Why it is? Why?
Food habits, lot of stress.
There is no. Okay, very correct. Food habits.
More than that, more than food habits is a sedentary life plus tensions. IT field is filled. Even homeopathic doctors, sir.
And see, there is no chitta for their food. There is no chitta for their food. See, they are eating more food at night, and simply immediately after go to the bed.
How can you resist beef fry? How can you resist what are that Kandari Alfam? It's not possible, sir. Getting out of the house, you are seeing Kandari Alfam and Kashmiri Alfam. I don't say it is that way, sir. Eat, but eat it in a proper way.
Definitely, it's Rionia, maybe. Yes. Then I think another important thing is you said about that this Madhya Pradesh. Yes, where the gas tragedy occurred. So definitely the Madhya Pradesh is the area where we can explain the gas tragedy, the intestinal system. Thank you.
Okay, that is also correct. That is also correct. See, Dr. Sadhath said one of my doubt is that. See, mesenteric gland inflammation. What do you have any experience?
Merxol tenam.
Okay, thank you.
Merxol tenam, Silesia tenam. That's almost specific.
Merxol, very correct.
Merxol and tenam. Silesia also.
Why it is happening?
Again.
Why? What is the reason for that?
Food habits and that villa gets destroyed, sir. Straight away infection goes into it. Everything comes here only now. One reason is polyp.
Mesenteric lymphadenitis is the most common ailments which are coming to our dispensary. Usually the children are affecting that. Mesenteric lymphadenitis, and they comprise about colic. That is the symptom, colic. While we are taking the US scan, we can understand that, see, this is mesenteric lymphadenitis. And see, most of all complaints are relieved by Merxol. That what you said is very correct. And give tuberculum. That is my opinion. Tenam 1 dose, tuberculum. Or otherwise it will be repeated.
Sir, calcarea carb also. Calcarea carb CM potency is also useful.
Good for that. Okay. Yeah. Thank you.
Thank you, Doctor. Dr. Sadhath said, please go through the chat box. We have some questions in the chat box and some suggestions also. Please go through it.
So mesenteric glands again, typhoid, you cannot even say if there's a history of typhoid, okay, you can think about typhoid in a man, paratyphoid, all that. But I don't think so. Every kid doesn't have a typhoid complaint. So I think Veena Ganesh. Every kids cannot give this one, no. And cholelithiasis to get quick results, colocin. Colocin tincture, I would say colocin tincture, or go to the higher potency of 10M. Repeat it. How frequent, how fast you wanted to get the relief, depending on that you fix up the which one dosage. 5 drops to 10 drops. You can give it. And another one is pain is renal calculi. Renal calculi, belladonna 10M. If the renal calculi is bigger and the pain because of that, if the stagnation is there, Ammi Visnaga, belladonna 10M. I have seen the cases. Okay, that also can be thought about it. Dr. S.K. Tiwari used to give belladonna 10M for renal calculi frequently, and if it's a higher 1.5 centimeters, it gives a beautiful result. See, most of the medicines are 30 until as I specified. Dose and potency and repetition. Repetition, don't ask me, because repetition and the sensitivity is depending on you. Every doctor is different. Repetition, for me, if you ask me, I repeat 10M, 50M, even 5 minutes, 10 minutes. 90% of the doctors will ask me, can you do it? Theoretically, can you do it? I said, theoretically, practically, I don't know. I'm a practical person. I want result. I want result in 5 minutes time. If something acute has to happen, acute is coming with me, result is the first thing. Rest, theory, practical, everything has to wait. Patient has to get the result with our medicine. If you have to repeat the medicine, repeat the medicine. That is experience. And how to take risk. The courage to take risk is on your doctor. If you have a courage to take and face anything coming up, do it. It will give you a report, a result. Until unless we don't take results, risk, we are not going to get an experience. Maybe failure, yes, failure is also a big experience, so that we don't do that, or we improve on the experience. No one, even I have not reached to this level, because without everything is successful.
Doctor, we
Everything.
have few more questions and only 2 minutes more.
You can ask
So
her.
try to answer some questions also.
What about inguinal hernia? Very sorry, I don't know. I have not tried. I have not given any medicine. It's a failure for me.
Cholelithiasis.
Cholelithiasis, to expel along with our medicine, you can even try apple treatment, apple therapy. Okay. You can explain, you can just Google the apple therapy. Okay, with our medicines, give 5, 6 apples every day, 3, 4, minimum 3 or 4 apples every day. You can give it as a juice or a boiled one or a raw one. Then on the 6th day, give olive oil in Epsom salt. That's called, that is an apple therapy. That gives you a better result along with our medicine. If the stones are too big, first we have to try crushing it out, because gallbladder CBD can block it. Okay. Okay. Any other one?
If any other query also, there is no time. Thank you so much. On behalf of IFPH, I am giving you a vote of thanks. Thank you so much. And I am inviting Dr. Ashok Kumar for moderating Malayalam session. Dr. Ashok Kumar, please.
Thank you, Dr. Rajini.